Welcome to #Wednesdays Weekly, a weekly training for our information sessions facilitated by Action Together in collaboration with the voluntary sector and our public sector partners. Today we have a session on reopening multi-purpose community centres, and our hosts are Sian and Sharon from Action Together and Jonathan Wilding from Rochdale Borough Council. I'm now going to hand over to Sharon.
Hi everybody, welcome. So just to introduce myself, I'm the Development and Volunteer Coordinator for Oldham. We've got a lot to cover today, so I'm just going to give a very brief introduction. Hayley, have the slides been shared yet, Sarah?
They're sharing now.
Here we go. So if you can go down to slide 4, please. Okay, so what a lot of you will have found out already, there's such a lot of information out there at the moment. Some of it will be relevant to you, some of it won't be. So what we're trying to do is help you with that, and we've set up a new web page. The details are on the screen, but we will be sending details of the link out to everybody after the session. And what we're trying to do with that is try and put the relevant information on there for you. And we'll be constantly updating this with tools and resources. So if you're looking for information, if you keep going back to the web page, you'll see the frequently updated tools, frequently updated links and guidance. What we've done is put on here, you'll see various headings when you go on it, but basically we've put together a checklist. Now this isn't an all singing, all dancing checklist, it's to help you start thinking about the things you might need to think about. And you'll find a lot of links in there. And I'll go through the links, I'll go through the text in more detail a little bit shortly. Also on our webpage, we're going to put local information about how you can keep up to date. So in here, this section, you'll find details of further training sessions. So we've got another session like this tomorrow. And then after that, we're going to do weekly Q&A sessions. So that'll be more informal drop-in, because I think as people start going through the process, they'll have some more specific questions about their buildings and their activities. And also we'll put up here details of any other training sessions hosted by other colleagues that you may find useful. And also here you can sign up to our weekly training bulletin. We send a weekly training bulletin to our members with details of any training that we think might be relevant for you. We're going to add a section on frequently asked questions. There are some up there now, but we've got more to add. And obviously, as we do these sessions, we'll take a note of the questions that are being asked and we'll update those as well. And also, we've got a section there on government guidance. There's such a lot of government guidance. We really are just trying to pull out bits that are relevant to you. And at the moment up there, we've got a section on the safe use of multi-purpose community facilities. And my colleague Sharon's going to go through that in a bit more detail with you later. Also, there's a section about maintaining records, the latest guidance on that. There is going to be a separate session on the 15th of July around test and trace that we're organising in Oldham, but everybody could access that. But that will, again, the details will be put up for that. And then there'll be guidance for other things, so close contact services, guidance that we think is particularly relevant to our members and the people who are going to access getting on, people who are going to want our support basically. And also how to contact us for further support. There's a lot of guidance out there, but we're here to help you, we're here to help the sector. And so that's details of how you can contact us and then you can speak to us. Obviously, I'm based in Oldham, Sarah's based in Rochdale, my colleague Sharon's based in Tameside. So we cover all 3 areas. Could you go on to the next slide, please? Okay, so as I said before, the checklist is really brief, but it's to help you start thinking about things you might want to do. And within that checklist, it's not full of information itself, but it's got the appropriate links and it takes you through the flow of what you might want to do. So first of all, you need to think about, well, can I reopen? Obviously, there's detailed guidance up there. You need to look at the relevant links. It's not a one-size-fits-all. Everyone's buildings are going to be very different, and the activities carried out within the buildings are going to be very different. So that will really affect what you can and can't do. So in each case, you're going to need to look at the nature of your building, the types of the services and activities. So just really treat this as a starting point, but you will find a lot of useful information in there. And again, we'll be constantly updating this. So first of all, can you reopen? Obviously, check the government guidance, go through the core principles of reopening. Shortly, Sharon will do that. There's some very detailed guidance out there. Just be wary that certain councils may maybe have their own requirements. I can only speak from an Oldham point of view, and I know that I haven't got the answer to that question yet. So, for example, where it's a council building, there may be just some extra factors that we need to think about going forward. Is your building COVID-19 secure? It's the 5 key principles to working safely. The first one is the COVID-19 risk assessment, which Jonathan will touch on later. Develop cleaning, hand washing, hygiene procedures, help people to work from home, maintain social distancing. Have you done a risk assessment? Risk assessment's key, and again, Jonathan will talk to us a little bit about that. But I think the key message is, from talking to a lot of groups and from previous sessions that other colleagues have held, is that just because you can reopen, it doesn't mean you have to. You need to look at this really carefully, do what's right for you, what's right for your groups. Really look at what your building is going to be used for. You may find that things have changed, your services have changed. You may find you've started up doing new things over this period. So you need to look at carefully each activity that that's going to be carried out within your building as well. And also in a checklist, we're going to include sector-specific guidance as more detailed things come out. But I'll just pass you on to Sharon now, because the guidance is issued. There's been some detailed guidance issued around safe use of multi-purpose community facilities. It's not our guidance, but it's government guidance, but I'll just let Sharon take you through the key points of that. Thank you.
Hello everyone. Nice to see some familiar faces. So I'm Sharon. I am the Volunteer and Development Lead for Tameside. So I'm going to take you through some of the guidance that was issued only last week for community facilities. It's going to be a very brief overview. We think it's useful to share some of those key points, but we do recommend that you take some time to read through them yourselves. Sorry, could you put the next slide on, Hayley, please? Oh. You can move on to the next one as well, actually. Thank you. So we put the link there on the slide, but we will share it in the chat and some of the information we share after the session. So the guidance that was produced last week, it applies to community centres, village halls and other multi-use community centres. But it's also useful guidance for those who run activities within these spaces as well. I think it's important to point out at the beginning of this that, and the government guidance states it itself, that this is very much a guide and it's been written in a general nature. So it's important to think about that, and Sharon's just touched on that really, that you need to be thinking about your own individual circumstances in your own building. The first point it addresses in the government guidance that we think is significant is around the completion of a COVID-19 risk assessment. And for every space that is reopening, it's important that you have this in place and that you ensure it follows the public health guidance and the safe workplace guidance. Now, on the government website, it does take you to more information on those two separate guidance. So if you need some clarification on that, it's important to make sure you've understood them. It does say in the guidance that it's at the discretion of those building managers, people who manage those buildings, to consider whether it is safe to reopen or not. And you need to think about your own circumstances. So what do you use your building for? What is the size of your building? What are the type of activities that you run in those buildings? Who uses it and how is it managed? These are all really important things to think about when you're starting to think about reopening. If you don't own a building yourself, but you use a space in a community building for your own activity, it's important that you risk assess your own activity, and that you take into account any of the guidance that's relevant to your sector. And I will touch on that briefly in a minute. But I think in the guidance, it's very clear that not one size fits all, as Sharon's just said, and that you need to feel confident and comfortable that you're able to follow the guidance and ensure that your building is COVID-19 secure. I think we'll be hearing that phrase a lot going forward. It also outlines in the guidance some information about what activities are permitted to open and what enforcements they could put in place if these are not followed. So I'm going to very briefly talk you through the core principles you need to follow when reopening. I won't go into too much detail because I know Jonathan is going to talk about some practical tips around risk assessments, but I just want to draw your attention to some of the key principles the government says that you need to think about when you're doing your risk assessment. So the first one is social distancing and capacity. The guidance states that if you're opening a building, you need to ensure that you can adhere to social distancing guidelines of 2 metres or 1 metre with risk mitigation. What they mean by risk mitigation is if you've got screens or masks in place. The size of your building will determine the maximum number of people you can accommodate with social distancing guidelines in place. Again, your risk assessment will help you think about that. But there's no maximum number. It's for you to make that judgment based on your size of your space. It then goes on to talk about cleaning, and it basically says that you need to have a good cleaning regime. And again, that in your risk assessment, you need to decide what is a sufficient level of cleaning and how frequently you need to do this. So, but again, it does give you more links and guidance in there. It then goes on to talk about hygiene and face coverings. It very much follows public health guidance, all the stuff we've been hearing about since the beginning of this, which is the frequent washing of hands and making sure that the people are doing this as they leave and enter a building. You've got those facilities available to wash hands, and if not, hand sanitizer available. It talks about face coverings, and I know there's lots of debate around face masks. But it does say in the guidance that you should wear a face mask if you're not able to socially distance and if you come into contact with people you wouldn't normally meet. So it's important to make sure you've understood that in the guidance. It talks briefly about vulnerable people. It doesn't give too much information, but I think what it's doing is just reminding us that there are certain people who are at increased risk of severe illness because of coronavirus, and this includes the over 70s. And that these people should remain at home wherever possible. So I think it's just important that you consider that when you're planning some of your activities. It talks about toilets and that these should be kept open and carefully managed to reduce the risk of transmission. But there is quite in-depth guidance on steps that you need to think about and to include in your risk assessment. Noise is the next one. There's no singing, live music or loud voices permitted within community facilities at the moment, as there is an increased risk of transmission. Now, they have said on the government website that there's going to be more guidance coming around this, but at the moment they're not permitted. And then finally, the track and trace, which Sharon's just mentioned as well. And what the government is asking that to support the NHS test and trace service, that all community facilities keep a temporary record of all your visitors for up to 21 days. And this is about helping them to contain any local outbreaks. So that's a really important part of this as we move forward. So what buildings, what activities are allowed inside community facilities? Well, we already know there's been lots of activities happening in terms of some of those public services like food banks has been a big one. And support for homeless people and blood donations and activities like that. And more recently in June, it opened up for early years provision and youth provision. But what they've said from last week, that clubs and groups can now meet again in those buildings, but only if those buildings are COVID-19 secure. And the same rules apply in terms of social distancing and those capacity limits. So if you're running those activities, you need to make sure you've thought about those. Activities that are not permitted at the moment are live performances, which include drama, comedy, live music, and if they're in front of a live audience. And that's to do with the transmission of, yeah, sorry, I've lost my train of thought. That's to do with transmission of COVID. And then also sport activities that would normally take place in a gym or a sports venue are currently not permitted indoors either. If you plan to meet in your community building to have a meeting, whether it's a civic function or you're coming together as a board of trustees, they do suggest that you meet virtually if you can, like we are now. But if not, that you adhere to social distancing. But they have provided further guidance to safe workplace guidance. And I think if you are meeting for this sort of activity, then you need to make sure you've read that and understood it, because you do have a duty of care towards your employees and your volunteers. So in terms of enforcements, I think at this point, all I'm going to say is that the risk, you're going to hear that a lot this morning, I think, about risk assessments, and that if you fail to complete a risk assessment and if you fail to put in place the measures to manage the risk, that could constitute a breach of health and safety law. So it's really important that you've thought through each of those points and you write those into your risk assessments. So this is probably a good time to pass over to Jonathan, who is going to talk a little bit more about risk assessments, and I think is going to give you some practical tips as well. Over to you, Jonathan.
I'm not an expert in it, but I'm going to give you some.
Jonathan. Oh, Jonathan, I'm really sorry. I think you're very, very quiet. I don't know why. I don't know if that's because of different Zoom.
What are you doing? Who took the charger from this room?
Sorry, I'm just going to mute that person there.
How do we do it? How do we return it?
Hopefully you can hear me now. Hi everyone, I'll start again from scratch. This is Jonathan Wilding here. I've been working with colleagues in the council on risk assessing our own premises. There's about 140, 150 premises we're working our way through. I'm on the call today with Jackie Evans, who's one of our environmental health officers. She's far more of an expert than I am, so when we take questions later, it'll probably be Jackie who's best placed to answer them. What I'm going to give you today is an insight into the process we've been going through with our own premises in terms of assessing the level of risk and the sort of things you need to think about before really considering reopening your premises. I mean, there are certain things to think about, actually not on the slide, before you even reopen, in terms of if the building has stood empty for during lockdown, there are certain things you really need to check through before you consider reopening around some of your standard checks and things. If there's water in toilet cisterns or water in storage tanks that's been sat there for the last 2 or 3 months, you need to really think about flushing through all those toilets, because of there are risks that are not really related to COVID, that are just related to the building having been empty for a long time. So I won't go into detail about those, but in terms of what we'd call them compliance checks, health and safety compliance checks, if anything's stopped or any inspections or any health checks have stopped while you've been closed, you have to reinstate all of that. And there are some things like Legionnaire's disease, for example, that have to be considered. Never mind COVID, there's other things to worry about too. But what I'm going to focus on now are the COVID specific factors. So you need to think about creating a social distancing plan. Obviously, crowding is one of the biggest risk factors facing you. I'm guessing many of you are in fairly small or restricted premises, so this is going to be a major impact on the activities you can offer. Where possible, it's a good idea to implement a one-way system. So there's a one entry point into the building, and if possible, a separate exit point, so people are not crossing in the doorways, because again, that creates quite a risk. I know that may not be possible for many of you, but certainly thinking about if there's a circular route you can get around your building, so you come in one area, and then you know, shuffle around in one direction and come out another exit. That would be ideal. If you've got a number of teams or a number of organisations sharing your premises, it's a really good idea to have a conversation around start and finish times. So so you know when people are arriving at the building, and if possible, you stagger those times. It may well be a lot of you are in shared premises where you're sharing with other teams, and you may not have direct control over those teams, but do get together and think about, when are we arriving, when are we leaving, can we kind of spread that out through the day a bit more and avoid everyone arriving at the same time. That in itself creates a risk. Obviously, from our point of view, we're trying to maintain working from home wherever possible. At the moment, our rule of thumb is if you can work from home, you should. It's just the safest place to be at the moment still. For our own, again, if you're heavily an office-based organisation, or you have a lot of desktops and workstations, we are going down. We're staggered. If like every other desk in our offices is being ruled out of bounds, so we're losing half our desk capacity in one fell swoop. But it's the only way to ensure people are not sat too close to each other. Also, if you're sat across desks from each other, facing each other, avoid that. Go for a sort of zigzag pattern, so you're not facing someone. I think generally, if you're working facing someone, that increases the risk. So try and make sure you're adjacent to each other rather than facing each other. I think someone's already mentioned cleaning protocols. We would say you've got to really, really focus on how often, if you've got a cleaning routine or a cleaning regime, make sure, if possible, they're coming in at least twice a day. And that in itself is not enough. You need to make sure whoever's using the space is also paying attention to cleaning as they go. So if there are high touch areas or things, light switches, printers, any part of the room, or in the kitchen, it may well be things like kettles or coffee machines, vending machines. Anything that's being touched regularly creates a risk. So provide a good source of wipes adjacent to those anything that's what we call a high touch area, high touch point. Make sure that gets wiped down on a very regular basis. Encourage every user that's using that to wipe it down before and, if possible, after they've used it. That does create a lot of used wipes, but it's a really, really an important thing to do. In terms of your social spaces, what we're trying to, the message we've been getting across to our own employees is you've got to stop really thinking of your workplace as a social space. In terms of lunch breaks, coffee breaks, we don't want people all huddling together or congregating together. That in itself creates a major risk. So we're removing half our, if you think about your sort of lunch area or wherever your staff have their lunches or their breaks, try and make sure they're nicely spread out and they're not all sat on top of each other. That's true also for meeting rooms. So if you've got meetings, again, if possible, do them virtually. Do them through things like Zoom. But if you are having to meet physically together, then make sure you've really spread that room out as far as you can, and you've got the 2 meter distancing rule. Across the public sector in Rochdale, we're sticking with the 2 meter distance rule. I know that was changed recently by government, but still the recognition is the ideal is still that 2 meter distance. So 1 meter plus may apply in some circumstances where you can't do anything else. But where possible, stick to the 2 meters is our advice. In some cases, we've got very small rooms with no ventilation available. We've actually had to rule out altogether some of our spaces. There are some rooms that are just not really ideal for this situation. Again, we recognise for you in some of the community settings, that might threaten to make some of your spaces really hard to use. If you can't ventilate them, if there's no windows and no way of getting fresh air into those spaces, that again means the air is not moving around and you've got an increased heightened risk in those. If you have got a very small room, try and make sure only one person really in the main is in that space. And what we've introduced in terms of encouraging people to move around, and that one-way direction thing I talked about, we've got loads of floor stickers down to sort of encourage people to understand which direction they should be moving in, and to avoid them crossing in corridors and pathways. If you've got staircases, even in our premises we have this challenge. You've got a narrow staircase. It may well be you can't see who's at the top of that staircase when you're down at the bottom. So we've introduced simple things like having a doorbell or a little bell or some kind of a warning noise that you can say, more or less, either shout up the stairs and say, "I'm just coming up, is anyone up there?" and really avoid crossing your path on. It's bad enough to cross on stairs anyway, isn't it? But avoid doing that if you can, and make sure there's some sort of notification process in place so people know you're coming up the stairs and they're not coming down at the same time. Can we move on to that next slide? I've already covered a lot of this, I think. Certainly for us, if you've got anything like a door, if you can avoid things like doorbells or contact pads, if you are going to have a contact point, make sure there's wipes available at that same place. Provide hand washing or hand sanitizers by your entrance, so anyone coming into the building is encouraged to wash their hands as they arrive, and again offer them the chance to do so as they leave. In terms of your desk, if you've got desks in your office, we are on clear desks every night. It makes them easier to clean. All that clutter on desks increases risk of infection. All of our desks are going to be completely bare. It makes the workplace a sort of sterile looking environment, but that's for good reason. It needs to be, and it allows your cleaners to get in and have a good wipe round, without having to move things around too much. We're avoiding the use of shared keyboards. If you've got workstations where people are plugging in and sharing a keyboard or sharing a mouse, and particularly sharing telephones, that is best avoided. Because those are high contact areas. Keyboards themselves can become a major source of infection. So if people have laptops, we're encouraging them to use their own laptops rather than plugging in and using shared keyboards, because that can create major problems. Food and eating plan. We've really minimised the use of any shared food in the workplace. So people are really encouraged to bring their own lunches in. We don't provide coffee and tea. Sadly, we can't provide coffee and tea for meetings anymore because, again, it increases that risk of infection. Where you are providing water, we've done away with where you have a water dispenser. Don't have that big stack of plastic cups by the water dispenser, because what happens is someone pulls one cup out, 4 come out at the same time, and they put 3 of them back. You've immediately created a risk of those cups that have been put back in the stack. So we encourage people to bring their own cups and bottles and that type of thing. I think, yeah, I mean, as I say, make sure your place, your premises have got plenty of access to hand sanitizers and wipes and that type of thing, that you don't have to walk too far to get hold of those things, so that they can be easily reached. Where possible, personal items are not going to be, again, this may not apply to you, but we're making sure people store away. If they've got their own personal items in the workplace, they're having to store them away every night and not leave them out. But that may not apply in your settings. But certainly encourage people not to leave their own personal possessions on their desk or in their office environment. Now, this one's really important. So this probably I should have started with this. One thing that's really important to do is think through, if one of your staff or one of your visitors falls ill while they're with you, while they're on your premises, you have to have a plan of action in place in terms of what you're going to do about that. It could happen. It's like if you have a lot of visitors, a lot of activities, it's quite likely. So you may not have the luxury of having a separate room or a first aid room, but if you do, you need to identify a fairly discreet, separate space where someone who's said they're feeling unwell can be allowed to wait without causing that risk of infection to everyone around them. It needs to be somewhere that's well ventilated, and you need to obviously call their next of kin as quickly as possible and get them to come and collect them. But you then need to, once they've been in that discrete space, you need to make sure there's a really thorough clean down of that space after they've gone. It's not something I think there's no point working that out once it's happened. You have to really think through what you'll do in that scenario. Oh, that one's not so relevant, I don't think. That slide's more about our internal council process. I'm trying to extract what's useful to you and what's relevant to everyone. So hopefully that's giving you a quick whistle-stop tour. I think the thing to do is actually walk around your premises. You know your premises better than anyone else. So walk around with a kind of checklist and actually think through the different situations and sort of almost do a walk around and imagine what, think through the activity before you've done it and try and identify all the things that could happen in advance of that setting, of that service reopening. And then you can kind of almost preempt anything that might happen. Hopefully that gives you a quick whistle-stop tour. There's, as everyone's saying, there was really comprehensive guidance out there. The government guidance is actually quite good now. I think a couple of weeks back we were worried there was nothing for the community sector, but there is now, and it's actually quite good guidance. So I really recommend you have a look at that. I think we'll be here anyway through the session, so I'll take questions at the end. So over to you guys. Thank you.
Brilliant, thank you ever so much. Thanks for that, Jonathan. That was really, really helpful. I apologise for some of my bad presentation skills, moving about up and round, and trying to admit people in at the same time. I just want to open it up to the floor. So we've got Sharon, who is the Volunteer and Development Coordinator for Tameside, Sharon, who's the Volunteer and Development Coordinator for Oldham, myself, who's the Development and Volunteer Coordinator for Rochdale, Jonathan, and is it Jackie, did you mention, from Public Health as well? So we have quite a few people on the call, and also I'm not saying that there aren't people here that have got your own expertise that you might want to share some hints and tips as well. I'm just going to quickly check the chat.